Okay, welcome back to TWIG. TWIG stands for This Week in Global Health. TWIG is a weekly live global health news roundup. Today is World Cancer Day, and so because of that, we're going to be talking about cancer today and the burden of cancer globally. Before we carry on, I'm going to ask the members of the panel to introduce themselves. We're going to start off with Chris. Chris, over to you.
Hi everybody, I'm Chris Ronson. I'm coming to you from San Francisco, California. Going to be giving a brief overview of World Cancer Day as well as various topics throughout the show. And just wanted to let everybody know that if you'd like to interact with us, ask us questions, give us your feedback, please feel free to do so before, after, or during the show via Twitter. We've got the @TwigTweet. We've got the @Twig team handle, as well as our own personal handles below. And you can also use the hashtag Twig to let us know that you're tweeting at us. So utilize those. We love hearing from you.
Okay, and the TWIG's webpage is www.twig.org, and you can comment on the webpage even during the show, and we should get those comments and be able to respond to them at the end of the show during the questions and answer session. Next up, Katie. Katie, talk to us.
Hi everyone, my name is Katie Jackson and I'm coming to you from Stockholm, Sweden. Today I'm going to talk to you a little bit about the risk factors for cancer. And if you guys are watching us from the future, let us know how it looks like. But also you can comment below on YouTube and we will get back to you. We really like interacting with our live and our futuristic audience.
Excellent, very good. I've never thought of them as futuristic. Okay, next up, Sulzan, talk to us.
Hey everybody, this is Sulzan and I'm speaking to you from Durham, North Carolina. I'll be talking to you about cancer in developing countries, the growing burden of cancer. And if you are listening to us on podcast, then a virtual high five. And if you're not, please go to our webpage, www.twig.org, and download the podcast. And you can listen to us while you're traveling or maybe doing housework. So,
okay, yeah. Great advert for the podcast. Thanks very much, Sulzan. And over to Brian from Johns Hopkins. Brian, over to you.
Hi, everybody. Brian Simpson from Global Health Now at the Johns Hopkins Bloomberg School of Public Health, and I'll be bringing a couple of the top news stories of the week to you, and then also sort of a lead-in to the World Cancer Day discussion.
Okay, thanks very much, Brian. And we're going to jump right in with Brian. Brian's going to give us a news roundup from Global Health Now. Brian, talk to us about the news. What's happened this week in Global Health?
Sure. So the measles outbreak in the U.S. remains sort of a top public health priority for the U.S. right now, with more than 100 cases spreading across 14 states. And a lot of this is the U.S. MMR vaccination rates coverage is actually pretty high nationwide, in the 90% or so. The concern, though, is that these micro communities where they have very low vaccination rates are sort of making the nation as a whole vulnerable. So as a continuing issue that Tom Frieden, director of the CDC, expressed that he was very concerned about the possibility of a large outbreak in the U.S. And we actually, here at the Johns Hopkins Bloomberg School of Public Health, we're going to host a symposium on measles that will be webcast on Monday from 9 a.m. Eastern Time to 1 p.m. Eastern Time, and that's jhsph.edu/measles 2015. Former U.S. Representative Henry Waxman and ABC News' Chief Health and Medical Officer Richard Besser are among some of the experts who will be talking then.
Thanks, Brian. And we will get that link into the show notes. So watch the show notes for that link. And just to let you know, next week's TWIG show is going to focus on measles. So tune back, come back, same time, same place next week. All right. Thanks very much, Brian. Next news item, another one from Brian. Brian, keep going.
Yes. So I'm going to roll with it here. So the one of the stories that just caught my eye this week was the surge in motorcycle-related deaths in Asia. There's been a huge increase sort of in the number of deaths, and they're likely to take more. It's likely to take more lives than HIV and tuberculosis in developing countries. Just as a couple quick factoids, the motorcycle crashes in Cambodia represent 2/3 of all road traffic deaths, and in Thailand it's three-quarters. So it's a huge and growing issue that's going to need to be addressed. Many people don't wear helmets, and licensing is also an issue there too.
That's a very interesting point, Brian, because not many people know that road accidents and injuries are actually among the top 10 global burden of disease, like in terms of burdens for health.
Mhm. Yeah, absolutely, and certainly as economies grow and people become more mobile, it becomes a greater concern too, for sure. And I'm going to move right on next to World Cancer Day. So today is World Cancer Day, and it's obviously one of the great concerns for global health of our age. And they're launching World Cancer Day, with the "Not Beyond Us" as a campaign tagline. So it's really looking at the positive aspects for the advances in prevention and treatment in cancer, but there's still huge issues to be dealt with out there. In China alone, about 2.2 million people die from cancer every year, which is, to me,
Wow.
an astounding fact.
That's incredible. I think that's actually about like 25% of the annual cancer deaths, so that's incredible.
Yeah, just alone.
Wow. Okay, that's interesting. Chris, can you talk to us a little bit about World Cancer Day and give us some facts and figures, just put this into context?
Absolutely. So as Brian mentioned, World Cancer Day is today, and the theme is Not Beyond Us. It was begun by the Union for International Cancer Control, or the UICC. Basically, as a major advocate, they do a lot of work with the WHO as far as informing and advocacy. The reason this is so important is because cancers figure among the leading causes of morbidity and mortality worldwide, with approximately 14 million new cases and 8.2 million cancer-related deaths as of 2012. And like Brian just said, the burden in China is over 2 million. So that's a huge number, proportion of those cases. Additionally, if we don't start paying attention and working towards cures and preventative care with cancer now, the number of new cases is expected to rise by over 70% in the next 2 decades and result in over 13 million deaths annually.
Wow. And just to give these numbers a little bit of context, and so you can compare them with something in developing countries. Cancer kills more people every year than HIV, TB, and malaria put together. So don't think of cancer as just a first world problem. Actually, this is something that affects the developing world in a way that is quite significant.
That's very true, Greg, but let's not forget that even in developed countries, cancer is a big problem. In fact, just today I was reading this article on Independent which talked about how 1 in 2 people in United Kingdom will develop cancer in lifetime.
Wow. Okay. So that's a huge number. 1 in 2, half of everyone in the UK will get cancer at some point in their lives. I mean, that's not to say that all of those people will necessarily die of cancer, but it's certainly, and something like prostate cancer in men, they say kind of if you live long enough, you'll either die with prostate cancer or of prostate cancer. So with men, certainly when you become older, your risk of getting prostate cancer eventually approximates your age. So if you're 80 years old, you've got an 80% chance of having prostate cancer. 90 years old, you've got a 90% chance of having prostate cancer, and so on. So, but it doesn't necessarily mean you'll die of it. But I mean, that's a great, so half of everyone in the UK is likely to get cancer at some point in their lives. That's a huge statistic.
And while we're going to be covering a lot of the global burden of disease and cancer in LMICs today, it's, just as Solzhen pointed out, important to remember that it is a global issue. I would like to take the opportunity, since it's World Cancer Day, to go ahead and mention that it's not just about the disease, but about the people. Cancer touches pretty much everybody. You either have had it or know somebody who's had it. And on that note, I just wanted to give a little shout out to Robert and Jessica Olsen. So Rob has been fighting advanced gray zone lymphoma since 2013, so I just wanted to send you guys a little bit of extra love today.
Okay, thanks very much. Well, we've talked about the fact that cancer is a problem in developing countries as well as developed countries. I'm going to ask Solzhen if she could give us a little bit of information about cancer in poor countries. Solzhen, over to you.
Absolutely. So cancer cancer incidence is rising across the world, and it is estimated by 2030 the incidence would rise by 65% in high-income countries and 100% in world's poorest countries. And to just give more context to that, 60% of the world's total new annual cases of cancer are occurring in the developing world, and these regions are also accounting for 70% of the world's cancer deaths. So you're talking about countries in Africa, Asia, Central and South America accounting for 70% of world's cancer deaths. And poor people in these countries are not only likely to die from cancer and die younger, but they also suffer more financial catastrophe due to out-of-pocket payments than people in rich countries, which creates a huge problem in these developing countries.
Yeah, that's a really good point, Susan, to say that the burden is felt more in low and middle income countries and those that are suffering from poverty. And it's also felt disproportionately in children. The cancer survival rate is only between 10 and 20% in low and middle income countries than 80% in developed countries. So again, where people are most at risk are with poor or with younger in age.
Chris, I think you're on mute.
Chris is on mute.
I got it now. I got it. I can do this. I think that's a really good point to make, is that you're talking about like the younger ages, the younger demographics, because in the past we've talked about access to medicine. So when it comes to pediatric HIV and things like that, when we begin talking about R&D, research and development, all the things that go into getting the necessary or the essential medicines to the populations who need them, we're not just looking at LMICs and developed countries, but we're looking at very specific populations, and the pediatric population is sort of carrying the largest burden of that. In addition to the facts that have been mentioned so far, cancer-causing viral infections such as HCV and HPV are responsible for up to 20% of cancer deaths in low and middle income countries.
Wow, that's a crazy number. But in fact, like I was reading this WHO fact sheet the other day, and it mentioned how 80% of liver cancers and 70% of cervical cancers are actually preventable by immunizing against the HBV, hepatitis B virus, and the human papilloma HPV virus. So just a simple immunization can prevent us from 80% of these cancers.
Actually, there's a really nice success story around the HPV, that's the human papillomavirus vaccination program. In Rwanda, they started an HPV vaccination program in 2011. And between then and now, they've actually increased the coverage of HPV vaccine to 80%. And this is in Rwanda. I think that's absolutely phenomenal. You know, can we clap? Do we have the clap button? No, we'll just do a real clap. Like, give them a round of applause. Well done, Rwanda.
Yeah, in fact, Greg, it's very interesting what they did in Rwanda. They actually tied up, the Ministry of Health tied up with Ministry of Education to unroll the whole vaccination, HPV vaccination program, which comes back to the crux of global health, that it's about partnerships. It's about building and your goals together.
Absolutely.
One of the things that a lot of people have made an example of the Rwandan health system and the strides that they've taken in, like, especially the last 2 decades. And so this is just another perfect example of how they've really begun to integrate healthcare as a necessity within their country, and it's an amazing chance to showcase how well they're doing.
It's a lovely example of strengthening health systems. And how that really impacts on all sorts of disease processes, including vaccinations, and that has a knock-on effect on cancer rates, et cetera, et cetera. So, as you say, it's a fantastic example. Right, Katie's going to talk to us about prevention of cancer.
Everything's just tying in perfectly here, talking about prevention and vaccinations and everything. So actually, more than 30% of cancer deaths can be prevented by modifying or avoiding certain risk factors. And these are kind of come to mind often. We've talked a lot recently in today's webinars, and on Twitter I followed the World Cancer Day hashtag, and it's all about this Western lifestyle that we have. So a lot of lifestyle factors. So being overweight or obese, lack of physical activity, not eating enough fruits and vegetables, eating really high processed foods, things like sexually transmitted HPV infection, HPV like we talked about before, and also alcohol use and tobacco use. And tobacco use actually is a really important one that I've heard a lot of people focusing on recently, because tobacco use is the single most important risk factor for causing cancer for about 20% of global cancer deaths, and about 71%, so a massive amount of global lung cancer deaths. And Susan mentioned before, many low and middle income countries, up to 20% of cancer deaths are due to infection by HPV or HPV. So 2 really good examples, or many different examples, of the idea of having preventative methods for avoiding cancer deaths. And I think that's really where the talk has been around today on World Cancer Day.
Yeah, if you're interested in cancer prevention, I'd recommend you go to the World Cancer Research Fund's webpage. They do a lot of work on diet and exercise and the impact on cancer prevention. I used to work there. I was the head of science and research there many years ago, so I'm a big fan of the work that they do, obviously. Okay, so before we end tonight's show, I'm going to ask Chris. Chris, I believe you've got 1 or 2 announcements you want to jump in with?
Yeah, we wanted to highlight a number of organizations. There are so many people who are involved in cancer advocacy and in the movement that we're going to put those in our show notes for you guys because the list is long, as well as on our website. One event that we did want to mention coming up is the YPCDN event that coincides with the weekend of CUGH. The American Cancer Society's Global Scholars Program, in collaboration with YPCDN and the Harvard Global Equity Initiative, is hosting a cancer advocacy training workshop at Harvard on March 28th to 29th of this year. The intensive 2-day training program will target and empower up to 25 motivated young professionals to lead effective advocacy campaigns to win real improvements in the lives of people living with cancer in underserved communities. So again, that link will be in our show notes, but to get the full details and to see the pamphlet that they have, you're going to want to head over to the YPCDN website.
Okay, fantastic. And Sulzan, you had an announcement?
Absolutely. So just after the YPCDN conference, Unite for Sight is hosting the Global Health Innovation Conference in New Haven at Yale University, and that's going to be from 28th to 29th March 2015. And we, Twig team, are going to be there. So if you're going to be there and you would like to get in touch and just stay in touch and contact us, please tweet to us, message us, go on our website and inbox us. So yeah.
We're also, just to mention, we're sort of dividing and conquering. So Jessica and Sulzan are going to be headed to GHIC. Katie and myself and our fantastic social media assistant will be headed to CUGH in Boston at the same time. So again, tweet us at Twig Team. You can get us on our Twitters. Email us at hello@twig.org if you want to get in touch. We'd love to meet up and talk to you guys a little bit more about issues and how you like the show or if you don't like the show, etc.
We're available for autographs as well.
Katie's gonna. We want to have a regular slot in the show called Katie's Career Corner. Katie's gonna advertise a job that's out there for people interested in global health. Katie, over to you quickly.
Only because my name starts with C. That's the only reason we're doing it. But Katie's Career Corner. So I have a background in career counseling, and I kind of am really interested in this education versus kind of entering the workforce sections. That's what I'm going to be focusing on. And actually, I have an announcement for an internship extension deadline. So the ECDC, which is the European Center for Disease Control, so we're kind of moving away from NCDs for this career announcement. They have an internship program. They call it traineeship. And you get paid while you work with the ECDC. You do have to be a member state citizenships. This is only for the EU, people that have an EU passport. But their traineeship extension is until the Friday at 17 hours. I don't know how to say that in 24-hour time. At 5 p.m. at Central European time. I'm so Canadian. Can you tell? So they have all their information on their website, and we'll tweet about it as well. We'll put it in the show notes. But if you would like a traineeship with the ECDC, they range anywhere from 3 to 6 months in length, and they have multiple different sectors that you can intern with. It's a great organization, and it's based here in Stockholm, Sweden.
Fantastic.
Katie, your basic math skills are on point.
1,700 hours? Is that how you say it? I've never said 24 hours like out loud.
Cool. It's cool. Don't worry about it. I just wanted to interject really quickly. Greg's about to give you the show wrap-up breakdown, but to let everybody know, we are going to be discussing a little bit. There are a lot of great articles and research papers that come back to World Cancer Day and learning about the different types of cancer. We're going to be talking about and including the New York Times article as well as some work by J.H. Piego. So if you're watching live, stay tuned. And if you're not watching live, the discussion will be up on our website. So check that out later on.
The show wrap-up breakdown?
The show wrap-up breakdown. I wanted to use opposing ideas in this one. I've also had a lot of coffee.
Listen, we're going to be talking about measles next week. So come back, same time, same place, or watch this on YouTube, or listen to the podcast. We'll talk about measles next week. The week after that, we're going to be talking about non-communicable disease. Again, it's an important topic, and we'll probably touch on cancer again at that point, of course. If you're watching this live, then don't go away, because we're going to go into a part of the show now that we do questions and answers, and we respond to comments that came over Twitter during the show. So stay for the discussion. If you're watching this on YouTube or listening to the podcast, this is probably goodbye to you. Thanks for watching. Don't ever change. Don't do drugs. Always do your best. And we'll see you same time, same place next week. Take care. Bye.
And Greg, if I could add, also get immunized, since we'll be talking about...
Okay. And also get immunized.